Assalamu alaikum. We are back with neurological assessment with me, Dr. Iram. As we discussed the lower limb tension test, today we are going to perform the third part of this test, that is the knee bend test. In knee bend test, we are going to progressively stressing the neural structures in lumbar spine and lower limb to see if these recreates our patient's symptoms of paresthesia or shooting pain within the lumbar spine or lower limb. The main structure affected by this test are the lumbar spine nerve roots, specifically the L2, L3 and L4, as well as the femoral nerve. We are going to show you how to perform this test on the patient right and left side. However, it's important to note that in clinical practice you definitely want to comparing the both sides so you can differentiate between affected limb and the unaffected limb. The two main components that we are going to perform for this test are the knee flexion and hip extension. The handling is very important in this test as to maintain the created position. Now we are going to perform on the patient. The first step is the knee flexion. The therapist flex the patient's knee to the end range are the point where the patients feel paresthesia or shooting pain. The second step is the hip extension, and we continuously ask from the patient, is you feel any paresthesia or the pain, as you can see from the patient's expressions. If the patients feel the symptoms of pain, then we relax the patient. If does not, then we continue it. As you see, the one hand is under the patient's knee and the dorsum of the foot of the patient is over the therapist's shoulder. In this way, we are going to examine the neurological structures in lower limb, especially the L2, 3, 4 nerve roots and the femoral nerve, then treat according to it.